Birthdays, anniversaries, weddings, whatever the occasion, it just got a little more personal with meaningful photo gifts from Shutterfly. Add a silly photo to a gold-rimmed mug for your bestie. Put your sweet puppy on a cozy fleece blanket for your teen. Gift your husband a desktop plaque featuring all the kids. Enjoy 40% off orders over $29 with code POD40 at Shutterfly.com and make something that means something.
We have all witnessed drastic changes in our daily lives as a result of new technologies, and that includes a lot of frustration with how technology affects our kids. Technology is also reshaping how families are made. I'm talking about reproductive technologies. From in vitro fertilization to surrogacy, these kinds of medical advances have given hope to a lot of people who dream of becoming parents. But with this hope comes a whole host of questions. And not just from adults. What are you supposed to say when your child asks about a friend who was born through surrogacy? Or when your child wants to understand why some families have two moms or two dads and a donor? These are the moments that kind of catch us off guard, but offer an incredible opportunity for us to teach our kids kindness, understanding, and some science. As a pediatrician, I often hear parents' concerns about answering these questions and having these conversations, but I also know you have your own questions about these technologies. It's hard to explain to a child if you're not entirely sure what's going on. What are the success rates of IVF? What risks should you consider for both the mom and the baby? How do you weigh the ethical and emotional complexities of using donor eggs, donor sperm, or embryos? And then there are the practical matters. It's expensive, there are legal issues, and an emotional impact on your family as a whole. If you're using reproductive technology, should you tell your child how they were conceived? And if so, how do you frame that story in a way that makes them feel special and loved? In this episode, we'll unpack a few of these big questions, giving you the tools and the information you need to support your family, whether you are just beginning this journey, or if you're supporting a friend, or preparing to answer your child's questions. Get ready for an episode that is as much about the science of reproduction as it is about the heart of parenting. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. I feel like I have more opportunities than most people. I have more opportunities to put my foot in my mouth. Here's my example this week. I always ask parents how tall they are so I can do a math formula that predicts how tall a child will be. And I didn't realize that I am an idiot until I asked a family this question last week, and the mom just stared at me until I remembered she used an egg donor. Duh, I knew this. I wrote it down. It was on her chart. Her height was irrelevant, and I recovered and moved on. Reproductive technologies are a part of my daily experience in clinic, and I should know better. When I round on newborns in the hospital, there is usually at least one baby born to a surrogate. And yes, I have absolutely walked into the surrogate's room trying to find a baby, only to realize that the baby is with the intended parents. Some families who use surrogacy are same-sex couples. I see a lot of those in the hospital. And many come to the US from countries that don't allow surrogacy. I have patients who used IVF to choose the sex of their child or to select an embryo without a genetic condition. These technologies are probably used more often than you realize. What is IVF? How does it work? Is it successful? And what do you do if you have leftover embryos? Dr. Emily Youngheim has some of the answers. She's a professor at the Northwestern University Feinberg School of Medicine and is chief of the Division of Reproductive Endocrinology and Infertility. Let's start with asking, how many children are born in the US from in vitro fertilization?
Right now, it's about 2% of newborns in the United States are born as a result of IVF. If you look at countries where there's universal health care and coverage for IVF, it's about 4%. So it's definitely significant. And this number is going to grow as people have more access to IVF and as the procedure and the techniques involved continue to improve. I once heard somebody compare it to the prevalence of red hair, which is about 1% to 2% of the population. So we all know somebody with red hair out there. And I think it's kind of interesting to think about, gosh, we may be encountering that many people on a day-to-day basis who've been born and who wouldn't be here without IVF.
In vitro fertilization can be very challenging and is an emotional roller coaster for parents. It can also be quite expensive. And of course, there are ethical issues to consider. You may know this already, but it's worth reviewing how IVF is done and why is it called IVF. Before Dr. Youngheim explains, I just want to provide a refresher on the basics. If you'll recall back to middle school, a follicle is a tiny sac inside a woman's ovaries that holds an immature egg. During a menstrual cycle, one follicle usually grows larger and releases a mature egg during ovulation. And here's a fun fact. Some women can feel the release of the egg as a pain between their menstrual cycles, and it has a fun name. It's called Mittelschmerz. Here's Dr. Youngheim to explain the role that IVF plays in this process.
The term in vitro basically means in glass. And the way I like to think about it, that's where the term test tube baby comes from. And so in vitro, again, in a test tube as opposed to in the body, which is in vivo. In vitro fertilization involves making embryos outside the body in a dish by placing eggs and sperm into that dish. The way it works clinically is we give women injections of hormones for about 2 weeks. And our goal is to get multiple follicles to develop at one time so that we can then go in and get the eggs from those follicles and hopefully make multiple embryos to use for her future use. Once the follicles on the ovaries get to the right size, we bring the patient to the operating room where she's put to sleep. And we gently place a needle into all the ovarian follicles, drain that fluid out, hand the fluid off to the lab. And the lab looks through, finds the eggs, and then places the eggs with sperm in a dish that's placed in an incubator overnight so we can watch to see which of those eggs fertilize and then follow those fertilized eggs to get embryos. And then those embryos can either be transferred back into the uterus or frozen for her future use.
The general term for these technologies is assisted reproductive technology, or ART. It was created to help people who have trouble getting pregnant on their own. Scientists and doctors wanted to find ways to overcome problems like infertility, genetic disorders, or health issues that make pregnancy difficult. It's not just all in vitro fertilization. What are some of the other technologies?
When we use the term assisted reproductive technology or ART, it refers to any procedure where we're manipulating gametes outside of the body. IVF is one form of ART, again, where we're taking eggs and sperm and putting them in a dish to make embryos. But other forms of ART include intracytoplasmic sperm injection, or ICSI, where we take an egg and inject it directly with a sperm cell, or pre-implantation genetic testing, where we'll biopsy some of the cells from the part of the embryo that becomes the placenta, then send those biopsies off for genetic testing, and also embryo cryopreservation.
For families worried about passing on genetic conditions, pre-implantation genetic testing helps check embryos for inherited disorders before they implant the embryo. This helps parents reduce the chances of their child having a genetic disease. ART also helps with common fertility problems like low sperm count by using a method called intracytoplasmic sperm injection, or ICSI, where a single sperm is injected directly into an egg to help it fertilize. For women who have trouble ovulating, hormone treatments can help their bodies produce eggs. ART also supports people who have had cancer because chemotherapy can destroy a patient's eggs or sperm. By offering options like freezing eggs or embryos to use later, we can help these families. Families can also use donor eggs or sperm if one partner's reproductive cells aren't available, giving them another way to have a biological connection to their child. Surrogacy is obviously another option, and that allows someone else to carry the pregnancy when a person can't themselves. These approaches give many families new ways to have children. Why do people need help? It seems like more people are using IVF. Why do some people have trouble getting pregnant naturally?
When people are younger, I would say it's really a matter of time and space. And what I mean by that is you've got these microscopic structures, the egg and the sperm, traveling within the reproductive tract, and they need to meet in the right place at the right time. Women only ovulate one day out of the month. And so essentially you're talking about 2 days where you could potentially get pregnant out of 30. So that's part of it. And then in order for an oocyte to fertilize normally, the chromosomal pairs within the oocyte or the egg need to separate. As we get older, these chromosomal pairs don't separate as well. And a resulting embryo can end up with too many copies of a chromosome or too few copies of a chromosome. This is called aneuploidy. Most aneuploid embryos stop growing early in development. This is why it's harder to get pregnant as we get older. And then also, if someone does get pregnant, they're more likely to miscarry at older ages. There are actually only a few types of aneuploidy that are capable of becoming a live birth. Again, just the limited opportunities to actually conceive in natural conception are part of the inefficiency. And then, the fact that these are microscopic cells that are trying to meet in this huge space, and then they have to implant normally and develop and grow normally. I mean, there's so many steps involved, but that aneuploidy piece, that abnormality in chromosome separation, that's a huge piece as people get older.
Examples of aneuploidy diseases include Down syndrome, which is caused by an extra copy of chromosome 21. That's why it's also called trisomy 21, because you have 3 copies of that chromosome. And Turner syndrome is caused by a missing X chromosome in females. There are a few other aneuploid conditions, but most are not compatible with life at all. I have a friend with a condition called a balanced translocation. 2 of his chromosomes are stuck together. He looks completely normal, but half of his children will inherit that stuck together chromosome, and half of his children inherit the regular copy. He and his wife had several miscarriages before they discovered this was the reason. All of the embryos who had his stuck together chromosome didn't make it. Eventually, they were able to conceive naturally, but they are an example of a couple who may have needed to use sperm injection to choose a sperm with the correct chromosome arrangement. Now you see why people might need these technologies to conceive. And of course, there are a range of ethical considerations when we're manipulating life. You can think about these technologies as a treatment for a medical condition of infertility. The treatments aren't perfect, and the effects need to be balanced. One issue is extra embryos that are created and not used. Why are there extra embryos when doing IVF? This and more when we return.
Even in the best of circumstances, the chance of becoming pregnant in a normal menstrual cycle where we're trying to conceive without assistance is only about 20% per month. With IVF, we stimulate the ovaries to get multiple eggs to work with. For example, if you get 12 eggs from ovarian stimulation, it's like a whole year's worth of trying to get pregnant. This can help improve the probability that we'll get an embryo that's actually capable of becoming a live birth. Sometimes we end up with embryos in excess of what we're going to transfer because our goal is to transfer one embryo at a time and get one healthy baby at a time. If we have embryos in excess, those embryos can be cryopreserved and used for future pregnancies so that a woman wouldn't need to go through multiple oocyte retrievals. But I think it's important to keep in mind that many people who go through IVF don't have excess embryos. They may not have that potential to get multiple eggs to be recruited.
In comparison to creating embryos through IVF, studies show that for naturally fertilized embryos, about 50 to 75% of them are not carried to term. Most of these losses happen very early, even before a person knows they're pregnant, due to failure of implantation or because of early developmental problems. The rate of miscarriage, which refers to the loss of pregnancy after implantation, is around 10 to 20% for known pregnancies. This percentage increases with factors like maternal age, with women over 35 experiencing higher rates of miscarriage. So this is not a particularly unnatural process for a lot of embryos to be lost. Doctors try to create many embryos with just one round of hormone stimulation and retrieval to save the mother the difficulty of multiple retrievals, which carries its own risks for the mother's health. In the case that a family has extra embryos, what options do fertility patients have for managing extra embryos?
Historically, the options have included donating the embryos to research, donating the embryos to someone else who's trying to conceive, keeping the embryos in cryo storage indefinitely or discarding those embryos. So, again, those are kind of the 4 general options that folks will pick. Some people will transfer the embryos at a time when they're unlikely to get pregnant. This is called a compassionate transfer. And I've had more and more people ask about this, as I think word has gotten around about this as being an option. But the bottom line is there are a lot of folks who struggle with what to do with their extra embryos. Patients are generally enthusiastic about donating embryos to research, but in reality, there aren't a lot of programs doing embryo research due to limited funding for reproductive health research. Also, survey work shows that people view their excess embryos as potential siblings to their children. And because of this, some folks struggle with that idea of donating their embryos to someone else who's trying to get pregnant. At the end of the day, the number of embryos in cryo storage is growing exponentially. And keeping embryos in cryo storage indefinitely is contributing to this problem that we've got. So it's important to discuss and get people thinking about what might I do if I have excess embryos early on. At the end of the day, most patients don't have embryos in excess of what they're going to use for their own family building purposes, but many do. And so again, it's just an important topic for folks to be aware of as they enter the process of IVF.
There are many options, and new options are becoming available all the time, including compassionate transfer, which Dr. Youngheim mentioned. The other thing that is changing recently are fetal personhood laws. They started in the late 1980s, but debates around them are continuing today. Fetal personhood laws are rules that give legal rights to an unborn baby, starting from conception or early in pregnancy. For example, there are laws that make it a crime to harm an unborn baby during an act of violence against a pregnant person, such as the Unborn Victims of Violence Act from 2004. This federal law recognizes that an unborn child can be a legal victim if they're injured or killed during a crime. Some states like Alabama and Georgia have passed laws that define life as beginning at conception, which can restrict abortion access. And in South Carolina, pregnant women can be charged with child endangerment if their actions harm their fetus, such as substance use during pregnancy. These laws vary widely across states, and they can affect decisions about abortion, medical care, and even accidents involving pregnant women. So, how might fetal personhood laws impact fertility medicine and their patients?
What I've seen and how it impacts patients and their fears and concerns. Laws are often written with specific scenarios in mind, but they can be applied in unintended ways. In the case of fetal personhood laws and fertility medicine, if embryos are deemed people, clinicians might fear that they could be held criminally liable if embryos are damaged or lost when treating patients. This could limit access patients have to life-changing technology. If infertile patients are led to believe that embryos are people, this can lead to a misunderstanding of what the treatment is, how it works, and they may be inclined to choose less efficient and potentially ineffective fertility treatments. So you may see more and more people who are misinformed about the process, who are left involuntarily childless as a result.
Dr. Youngheim is referring to alternative treatments for infertility, like herbal supplements, acupuncture, or fertility diets. These treatments don't have strong evidence that they work, and they may be ineffective. Other practices, such as homeopathy, crystal healing, and detox cleanses, those are considered fringe and have no proven benefits. These methods can waste your time, delay proper treatment, or even harm overall health if they're used without guidance. So it's important for an infertility patient to understand the range of technologies that are available to them so they aren't taken advantage of and are comfortable with their options. These issues are difficult to discuss, and it's hard to understand them even as an adult. So how should an adult respond when a child asks about a friend who is not biologically related to their parents or who they know was conceived through IVF? Parents can explain that IVF is a special way that some babies are made when it's hard for parents to get pregnant the usual way. Parents can share that doctors help by creating an embryo, and then the embryo is placed in the mom's belly to grow. Parents can reassure the child that the baby is just as loved and special as any other, and that there are lots of different ways to bring babies into the world. It's a great opportunity to teach about how families come in a lot of different forms, but what really matters is love. In my experience, when kids ask a difficult question, it's important for parents to keep their answers simple. Children are just looking for a basic explanation. They aren't looking for the details. It's helpful to you to listen carefully, respond with just enough information to satisfy their curiosity without overwhelming them. If they want to know more, they can always ask again. So stay calm, open, and be straightforward. That helps a child feel comfortable asking more questions in the future. If you have a question about a difficult topic, send it to me. The tough questions are my favorites. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.